Could this possibly happen to you? Well, it could. We're going to talk about it today. Ways it can happen that you kind of know it's coming, and other ways where you've done all the right things and it can still happen. Hi, thanks for joining me today, Dr. Rajani, and we're talking about kind of botched lips. The most common areas you see this are going to be the lips and the buttocks, and I'm going to talk about how to avoid it, what are some warning signs, and what are, if you do everything right, it can still possibly happen, but it's often a better scenario and a better outcome. If you like these videos, click like below, subscribe, and click that bell because that will mean you'll be notified of all the new and upcoming videos that we have. Also go to the playlist. There's a lot more in-depth information on everything, including side effects from fillers, what to watch for, how to pick great injectors for yourself. So we never like to see this, and what prompted me to do this video, I've done some for people in Florida, Miami, and different areas. There are hotspots in the country where this is happening. And one recent of a group of 7 people who went and got injected and ended up with product they didn't know was in the lips. There was some necrosis, it was question of infection and nodules, and the pictures were terrible. And the people were scared. And that's probably my most important message to you is everything's great and fine until things go wrong. And how do I know? On Instagram and here on YouTube, sometimes in the general comments below, but I probably get 7 to 10 instant or messenger messages, private messages about side effects in a given day. People don't come to me and contact me and everything's going well and things are great and hunky-dory. How are you doing, Rajani? I don't get that. When people have a side effect from a problem, whether it's a legitimate clinic or legitimate case, or many people, especially through Instagram, will just private message me about things they've done at home and the Hyapen and different radio frequency devices that came from overseas that they're using. And when everything goes well, it's great and they might like the results, but when it goes south, anxiety takes over and it's a spiral. And when you have no one to call or no one to help you because it's self-inflicted, or those people who injected the product are gone, I can tell you it's the most devastating experience. And many injectors who deal with things like this help people, but in many ways it's difficult because you don't know what's in there. So what are some of the warning signs? Real quick initially, if you're going to somebody's house to get a treatment, I'm going to call that a warning sign. Now I know there are home treatments done in home care and IV infusions at home. And I personally, people can do what they want. I don't have a vested interest other than that people stay as safe as they can. And it's part of why you're watching this channel. But if you're going to someone's home to get a treatment done, even if your friend recommended that they've been going there for a year, chances are that you can't get product shipped to a home unless it's illegitimate product. Chances are that product's coming from somewhere. And the biggest problem with product is certainly storage and handling. Is it kept too warm, too hot, too cold? But what is it? And there's cases where it has nothing to do with high hyaluronic acid. We're talking about lips, and it's the most common thing injected in lips, but because it can be dissolved relatively easy and simple. I was just watching a botched video where someone thought they were going to be botched and they thought it was a side effect that I don't even think it was, but they were saying, oh, I could die from the dissolver. And well, you have much more risk of dying from many other causes than from hyaluronidase, which I use daily in my practice. But those are the misconceptions out there. So if you find yourself going to a house, probably you're not going to get the follow-up care. I've certainly seen many problems come from those scenarios, and part of the problem is there's no one you can call to say, hey, what did you put in? Is it dissolvable? Is it permanent? If there's a vascular compromise for follow-up. So that would be your first thing. If you're going to a house, especially if you're going to the back door and not the front door, big problem. Number 2 is when you go even to a clinic, and clinics are in many areas of a given town, there's nothing wrong with asking your provider their credentials. They're never going to be offended. No one's going to be offended. Hey, what was your training? How long have you done it for? What products do you use? Where do you get them from? to be very frank here, clinics who do these kind of treatments and they do just a basic given amount of volume are going to get pricing that they can pass on to you that is within the industry standard, because they have a relationship with a company where they're getting their neuromodulators, their Botox, their fillers, and in many cases devices like Cool Sculpting is with Allergan. And when you're in with a family, there's no need to be ordering products from overseas or illegitimate areas for legitimate clinics. That's the bottom line. So ask questions. Okay, certainly you can see the product if you want. There's nothing wrong with asking. We're not offended by that. The third, we should talk about self-injecting, and I have a whole video on it. But I know it's popular, and I know this isn't the least expensive habit to get aesthetic services. But there are a lot of problems with self-injecting I won't go into today. But really, things happen, and oftentimes you have to see hundreds of treatments, like many of us have who do this and are in this field, to know how to deal with the late onset nodules, allergic reactions, occlusions. Just deciding if something's a bruise or an occlusion, a lot of experience goes into that for your injector to know the anatomy. But even if you know your anatomy, it doesn't matter. We all have different anatomy. There's aberrancies. So that would be, we'll touch on that lightly. And then the fourth is home treatments like the HyaPen. I did a video on the HyaPen or hyaluron pen, whatever you want to call it, where you blow filler into the lip. Remember, this is a drug, and they call it that on their site. And when you're trying to blow a product in through the mucous membrane, it's fraught with some problems. And if you like it and you're getting great results with it, it's not a problem. Let us know here in the comments below. Educate us. But in general, what drug are you blowing into your body? If it's going into your body, you should know exactly what's in it. And often there isn't even a product list for this. And I can tell you from people that touch base with me weekly, probably about side effects from this pen. Because there's a lot of unevenness, bruising, and pain, people need guidance. No physician can really guide you on what to do with this. They don't know what you've put in the body through the HyaPen. If a physician or clinic uses it, typically they're going to use something like Restylane Silk or a light Vicross Allergan product to try and get it through. It needs to be a small molecular size, like Restylane Silk, 50 microns. In Europe, Vital Light would be skin boosters. So how can you get this if you've done everything right? Well, it's absolutely possible to get lumps, bumps, very enlarged lips, especially in the early 2000s with some of the products we saw it. And with some products that have come to market and are gone from the United States, we would see, and it can happen with the products today, a histamine response and how you treat that. But it's differentiating a bruise, a histamine response, a delayed onset nodule from an arterial occlusion. And that's really where you're depending on the advice of your injector with experience who's going to be there to follow up with you. It's absolutely key. But keep in mind, when you ask a question of a provider, be it me here on Instagram or you go to the clinic after you've been injected somewhere else, they really have trouble helping you because they don't know what was put in. So knowing what was put in helps decide, could it be a delayed onset nodule? Of course, histamine response can happen with any product. Some products are more common than others. And remember, a small molecule product is going to draw more watering because there's more surface area for product placed in. And hyaluronic acid draws water in. That's what it does for a living. Watch my video on hyaluronic acids. So your provider will know, oh, I put a small molecule in to redden the lips to give a little bit of pop. That swelling can be normal with that product. And so I know how to handle that. It's a total different management than other causes like delayed onset nodules. So my other videos will expand on all the things I talked about, but I want to hear from you. And be frank, because there are people that self-inject and they're happy doing so. There are people who self-inject who have had horror stories, of course, and who have had bad experiences going to backyard clinics, maybe we call it. But let us know your experience below. This is an educational forum for us all to learn and navigate the aesthetic world and market. Subscribe to the channel. Give us your opinion here. Join us over on Instagram where we discuss these things as well. And stay tuned here to keep your skin and body beautiful, healthy, and vibrant.